Yeah, I think it is important for physicians to recognize that we have choices. There were two really good studies which were recently reported around dealing with intolerance to BTK inhibitors. Recognize a couple of things, that with Ibrutinib you can dose reduce, and most of the side effects will get better, if not go away, except atrial fibrillation. And that's really an important, outcome of the study by Shana Sarosiak that was performed at our institution. Out of 10 patients who were on a very large cohort of patients who got atrial fibrillation, 9 still had recurrence of their atrial fibrillation even with dose reduction. So if the complication is atrial fibrillation, the best option there is to go to Zanubrutinib. And we learned from the nice study that Mazur-Shadman performed that a switch over to Zanubrutinib, actually, guess what? 9 out of 10 patients did not have recurrence of their atrial fibrillation. So I think it is really important to keep in mind that we do have options. We also have now Pirtobrutinib, which is also entering in the mainstream of caring for patients with Waldenström's. But as we sort of, levy out side effects, intolerance, as well as resistance, to covalent BTK inhibitors, it is really important for our colleagues to recognize that we now have expanding options for use.